A comprehensive overview on cataracts. Do you ever feel like your vision is becoming cloudy, as if you're constantly looking through a frosted window? You might be experiencing a cataract, a common eye condition that affects millions, especially as we age. This article provides a comprehensive overview, explaining what cataracts are, their common symptoms, typical causes, and why early detection is important. It also details the effective surgical treatments available today, explores ongoing research for non-surgical options, and discusses lifestyle factors that may influence their progression. What exactly is a cataract? To understand cataracts, let's first look at how your eye works. Inside your eye, behind the colored iris, the part that gives your eye its color, there's a clear, natural lens. Think of it like a camera lens. Its job is to focus light onto the retina at the back of your eye, which then sends sharp images to your brain. A cataract occurs when this normally transparent lens becomes cloudy or opaque. This clouding happens as proteins within the lens break down and clump together, scattering the light that tries to pass through. The result? Your vision becomes blurry, hazy, or dim. Common signs and symptoms. Cataracts usually develop slowly, so you might not notice changes right away. However, as they progress, you might experience cloudy, blurry, or dim vision. This is the most common symptom, making everyday tasks like reading or driving difficult. It can feel like looking through a foggy window. Difficulty seeing at night. It might become harder to see in low light or notice that streetlights and car headlights cause more glare. Increased sensitivity to light and glare. Bright lights might appear dazzling or cause discomfort. Seeing halos around lights. This can be particularly noticeable around streetlights or car headlights at night. Fading or yellowing of colors. Colors might seem less vibrant or take on a yellowish tint, making it harder to distinguish certain shades. Double vision in one eye. In some cases, a cataract can cause you to see two images with a single eye. Frequent changes in eyeglass prescriptions. Vision might change often, requiring updated prescriptions, as the cataract continues to affect focus. What causes cataracts and when do they appear? While the most common cause of cataracts is aging, several other factors can contribute to their development and speed of progression. Age-related cataracts, the typical timeline. Cataracts are primarily an age-related condition, meaning that if people live long enough, almost everyone will develop some degree of lens clouding. Initial formation, often unnoticed. The very earliest protein changes in the eye's lens can begin as early as your mid-40s to 50s. At this stage, these changes are usually microscopic and do not affect vision. An eye doctor might detect these subtle signs during a routine eye exam, even though the individual would not notice anything themselves. Noticeable symptoms. For most individuals, significant vision problems from age-related cataracts do not typically emerge until they are in their 60s or 70s. More than 90% of people over 65 in the United States will have some form of cataract, and by age 80, over half of all Americans have either developed a cataract or undergone cataract surgery. Progression rate. Age-related cataracts are generally slow progressing. It can take many years, even decades, for these cataracts to mature to a point where they significantly interfere with daily life and necessitate surgery. While early symptoms might appear, it is common for many years to pass before surgical intervention becomes truly necessary. Other causes and factors influencing earlier or faster progression. While aging is the primary driver, cataracts can develop at much younger ages or progress more rapidly due to other medical conditions or lifestyle factors. Medical conditions. Diabetes. Uncontrolled or poorly managed diabetes is a major risk factor. High blood sugar levels can directly affect the lens, leading to cataracts forming at a younger age and progressing much faster. Certain genetic conditions. In some cases, individuals may be born with cataracts, congenital cataracts, or develop them early in life as part of specific genetic conditions. Other eye conditions, chronic inflammation inside the eye, such as uveitis, or a history of certain previous eye surgeries can lead to cataracts that form and progress more quickly. Medication use. Corticosteroids. Long-term use of corticosteroids, whether taken by mouth, inhaled for conditions like asthma, or used as high-dose eye drops, is a well-known cause of cataracts, often leading to their development at an earlier age and with faster progression. Trauma to the eye. Eye injury, a direct injury to the eye, even if it occurred years ago, can cause a traumatic cataract to form. These can develop relatively quickly after the injury or appear much later. Lifestyle factors. Smoking and excessive alcohol consumption. Both heavy smoking and excessive alcohol intake are significant risk factors that create harmful substances in the body, accelerating cataract formation and progression. Excessive UV exposure. Prolonged, unprotected exposure to the sun's ultraviolet, UV, radiation can also contribute to earlier onset and faster development of cataracts. Why earlier or faster cataracts can be a sign of other health issues. If an eye doctor detects cataracts at an unusually young age, for example, in the 30s or 40s without a clear history of eye injury, or observes surprisingly rapid progression, this can be an important clue to an underlying medical condition or a significant lifestyle factor at play. Eye health often provides important insights into overall health. For instance, if cataracts develop earlier than expected, an ophthalmologist may recommend screening for diabetes or reviewing current medications, as addressing these underlying issues is crucial for both eye health and general well-being. The critical importance of early detection. Given that cataract surgery is primarily performed when vision is significantly impaired, one might wonder if early detection is truly necessary. The answer is a resounding yes. Early detection of cataracts, even before vision is severely affected, offers numerous crucial benefits. Monitoring progression. Cataracts progress at different rates for different individuals. An early diagnosis allows an ophthalmologist to establish a baseline. Through regular checkups, the cataract's growth can be monitored, its individual progression understood, and an anticipation of when it might begin to interfere more significantly with daily life can be made. Managing early symptoms. In the initial stages, surgery may not be immediately required. However, early detection allows eye doctors to recommend strategies to manage mild symptoms. This might include updating eyeglass prescriptions, suggesting brighter lighting for tasks, recommending anti-glare coatings on glasses or special sunglasses, or even suggesting magnifiers for detailed work. This helps maintain quality of life even before surgical intervention becomes necessary. Ruling out other conditions. Blurry vision is a symptom of many eye conditions, some of which are far more serious than cataracts and require urgent treatment to prevent permanent vision loss. Early, comprehensive eye exams for cataract detection help ensure that other potential issues like glaucoma, damage to the optic nerve, macular degeneration, deterioration of central vision, or diabetic retinopathy, damage to the retina from diabetes, are not overlooked. Informed decision-making and planning. Knowing about cataracts allows for proactive planning. An individual and their doctor can discuss the optimal timing for surgery based on how the cataract is impacting specific activities, driving, reading, hobbies, work. This empowers informed decision-making, choice of the most suitable intraocular lens, IOL, the artificial lens that replaces the natural one, from various options, such as lenses designed for distance vision, near vision, or correcting astigmatism, an arrangement of logistics like time off work or transportation, rather than being forced into an urgent procedure due to severe, sudden vision loss. Potential to slow progression. As discussed below, certain lifestyle modifications and dietary choices may help slow the progression of cataracts. An early diagnosis can encourage the adoption of these beneficial habits, potentially delaying the need for surgery. Maintaining safety. As cataracts worsen, they can severely impair vision, making activities like driving or walking safely very difficult. Early detection allows for timely intervention before vision reaches a dangerously compromised level, protecting both the individual and others. In essence, early detection is about awareness, meticulous monitoring, proactive symptom management, ruling out other serious conditions, informed planning, and ultimately, maintaining safety and quality of life. Treating cataracts, the current standard and future hopes. When cataracts begin to interfere significantly with daily activities and quality of life, the only currently proven and definitive treatment is cataract surgery. The role of surgery, what to know. Cataract surgery is one of the most common and successful surgical procedures performed worldwide. It is a highly safe and effective procedure that typically lasts less than an hour. The procedure, during the surgery, the cloudy natural lens is carefully removed through a tiny incision, often with the help of ultrasound technology. Once the natural lens is removed, it is replaced with a clear, artificial intraocular lens, IOL. This new lens remains permanently in the eye. Pain and recovery. The procedure is usually performed on an outpatient basis, meaning the patient goes home the same day. Local anesthesia is administered to numb the eye, so typically no pain is felt during the surgery. Most patients experience a quick and relatively comfortable recovery, often noticing improved vision within a day or two. Eye drops are typically used for a few weeks to aid healing, and there might be some temporary restrictions on activities like heavy lifting or rubbing the eye. Safety and success. Cataract surgery has very high success rates, with most patients experiencing significantly improved vision and a much enhanced quality of life. Non-surgical treatments, current reality and ongoing research. A crucial point to understand is that there are currently no FDA-approved medications, eye drops, pills, etc., that can dissolve, reverse, or completely heal existing cataracts. The clouding in the lens is caused by irreversible changes to proteins, making it a significant scientific challenge to develop a drug that can undo this damage safely and effectively within the eye. However, the search for a non-surgical solution is a very active and promising area of scientific research. Scientists are exploring several avenues. Potential eye drops. Researchers are investigating new compounds that might be able to dissolve the protein clumps that form cataracts. Early lab and animal studies have shown some encouraging results for these cataract-dissolving eye drops. For example, recent studies are exploring proteins found in hibernating animals that allow their cataracts to clear naturally, offering new ideas for drug development. While these findings are exciting and offer hope for the future, they are still in experimental stages and have not yet been proven safe or effective for widespread human use. Other advanced techniques. Beyond eye drops, other advanced, non-invasive techniques are being explored to treat cataracts, but these are also in the very early stages of research. It is vital for individuals to be aware that any over-the-counter eye drops or products currently claiming to cure or dissolve cataracts without surgery are not backed by strong scientific evidence or FDA approval. Always consult with an ophthalmologist before considering any such products. Can lifestyle changes and supplements slow progression? While no medication can reverse cataracts, there is compelling evidence to suggest that certain lifestyle choices and a diet rich in specific nutrients may help slow down the progression of cataracts or reduce the risk of their initial formation. The focus here is largely on antioxidants, which are compounds that help protect the body's cells from damage caused by unstable molecules, a process called oxidative stress, which is believed to contribute to cataract development. Here's what is often recommended. Protect eyes from UV light. Prolonged exposure to the sun's ultraviolet, UV, rays is a known risk factor. Always wear sunglasses that block 99% to 100% of both UVA and UVB rays whenever outdoors, even on cloudy days. A wide-brimmed hat adds an extra layer of protection. Quit smoking. smoking significantly increases the risk and accelerates the progression of cataracts. Manage underlying health conditions. For individuals with diabetes, strict management of blood sugar levels is crucial, as high blood sugar can hasten cataract development. Managing high blood pressure also plays a role in overall eye health. Limit alcohol consumption. While moderate alcohol intake may not pose a significant risk, heavy drinking has been linked to an increased risk of cataracts. Maintain a healthy weight. Obesity can indirectly contribute to cataract risk through its association with other health issues. A balanced diet and regular exercise are beneficial. Dietary focus on antioxidants. Vitamin C, ascorbic acid, a powerful antioxidant found in high concentrations in the fluid surrounding the eye's lens. Studies link higher dietary intake of vitamin C to a reduced risk of cataract progression. Food sources: citrus fruits, oranges, grapefruit, berries, strawberries, blueberries, bell peppers, kiwi, broccoli. Vitamin E, another important antioxidant that may help protect the lens from damage. Food sources: nuts, almonds, hazelnuts, seeds, sunflower seeds, vegetable oils, leafy green vegetables, spinach, broccoli. Lutein and zeaxanthin, these are beneficial plant pigments, carotenoids, that accumulate in the macula and lens of the eye, acting like natural sunglasses by filtering harmful blue light and providing antioxidant protection. Food sources: dark, leafy green vegetables, kale, spinach, collard greens, eggs, corn, peas. Omega-3 fatty acids, these healthy fats are important for overall eye health and may have a protective effect against cataracts. Food sources: fatty fish, salmon, tuna, mackerel, sardines, flax seeds, chia seeds, walnuts. Note on supplements: while a diet rich in these nutrients is highly recommended, the evidence for isolated dietary supplements specifically preventing or significantly slowing cataracts is mixed and often inconclusive from large, controlled clinical trials. It is generally advisable to obtain these nutrients primarily from whole foods due to their natural synergy. Always consult with an eye doctor or a healthcare professional before taking any new supplements, especially if there are existing health conditions or other medications being taken. Conclusion: important information about cataracts. Cataracts are a common age-related condition that causes the eye's natural lens to become cloudy, leading to blurry vision. Understanding this condition is key to maintaining good eye health. In summary, here are the key points about cataracts. Cataracts typically develop slowly over many years, usually becoming noticeable in an individual's 60s and 70s. The appearance of cataracts at an unusually early age or their rapid progression can sometimes indicate the existence of other underlying medical conditions, such as diabetes, or significant lifestyle factors. Early detection of cataracts through regular eye exams is crucial for monitoring their progression, managing initial symptoms, ensuring other serious eye conditions are not missed, and allowing for informed planning regarding future treatment. Currently, cataract surgery is the only effective and definitive treatment. This is a safe, quick, and highly successful procedure that replaces the cloudy lens with a clear artificial one, restoring vision for most patients. Non-surgical cures for cataracts are not currently available or scientifically proven. Research into potential eye drops and other methods is ongoing, but these remain experimental. Certain lifestyle choices, such as protecting eyes from UV light, quitting smoking, managing health conditions, and consuming a diet rich in antioxidants, may help slow the progression of cataracts. Your vision is a vital aspect of your health. Regular comprehensive eye examinations are essential for monitoring eye health and for the early detection of cataracts or any other ocular condition. For any concerns about vision, consultation with an ophthalmologist is recommended for accurate assessment and advice.